Very much, Mr. Chairman. When you mentioned the user fees and everything at the FDA, it'd be important to see what the appetite is for a user fee for the food part of Food and Drug Administration. Because if we could get a user fee on the food side, we could have a much bigger budget for staffing and the rest on the food side of Food and Drug Administration. A. B. The FDA has no power to recall. We say recall, but it really is a moral suasion issue. The Food and Drug Administration can say something is wrong with this, and then the public reaction to it is effectively the company would then perhaps recall. But there is no power. We have it in the BBB, we've had it in the BBE in hopes that we could pass it there when we haven't been able to get it over time in other legislation that required a strong bipartisan vote. So in terms of recall, when we use that term, it is not the power of recall, it's the persuasion of a company recalling voluntarily. So you see, we have a stronger hand to play here if we would be willing to do so. There is also some attitude in the country that there is plenty of supply, it's just not all in the right places, but there must be a computer program that tells us where that is. If that is so, then let's get that moving right this minute into the mouths of babies. We fight all the time not to take food out of the mouths of babies, as some initiatives might result in. As a mother of 5, grandmother of 9, a long time ago for me, I can still hear a baby cry. My baby is hungry. A mother should not, a parent, dad, mom, grandparents, whomever, caregiver should not have to hear a baby cry without being able to fulfill the need, to anticipate the need. Again, it must be safe. We have to be cautious in how we proceed, but we have to do this as quickly as safely possible. So with that, we're pleased to take any questions. Yes, ma'am.
I wonder if you can talk a little bit about how this $28 million is going to, it seems like it's going to FDA, but is there a world in which FDA can then put that money to the companies that'll actually be needed
No.
to overstep with production stuff, or just help on the food side?
No, what this does is divide it up into infant formula and supply chain monitoring and assessment for $1.5 million. Health fraud, state partnerships, laboratory methods development, $3 million to the Office of Regulatory Affairs. Social media data capture, analysis to identify unsafe infant formula so we can track stuff online, and that's $500,000. Then it's infant formula and staffing. It's $23 million. The speaker spoke about if we are going to bring more companies online that are FDA approved, and that is either domestically or internationally, those facilities have to be inspected. FDA does not have the adequate inspection force to be able to do that and to do it in a timely way. The other piece, as I mentioned earlier, you're going to look at companies who want to try to provide us with a product who may not be FDA approved. That is a submission. 9 people. That's it. So the crux of this is providing infrastructure, if you will, in order to do what needs to get done, and that is about as quickly as possible how we get product in and get it on the shelves. And that is what this is about. It's supply chain, it's data, it's looking at fraud. My God, you could have anybody coming forward and say they do this, they do that, and so forth. Unless we have a standard to which to judge them by, and unless we can inspect and look at all of this, you know, we take a very big risk. And today, the speaker spoke about mothers, parents today are saying, okay, and that they go to a pediatrician and say, what should I do? And the pediatrician may even say, take a chance because it's maybe okay. But think about it as being a mother. You need to feed your baby, and then you're scared that if what you feed your baby is going to cause harm. So what we want to do is to provide the resources as quickly as we possibly can, get this done, then take up the issues of accountability. And I spoke about accountability at the FDA as well, because they dragged their feet for several months before there was a recall. And the speaker is right. We don't have any power of recall. It's the company who determines whether or not they're going to recall the product.
That